Hello, everyone, and thank you for joining in on another Ask Miss Jai Live. I am so excited to be here today to share some information with you all about sex positivity and sex negativity and the ways that these look. If you stick around for the next 15 minutes, you'll get a chance to learn a little bit about how sex negativity and sex positivity impact our sexual health and impact our sexual health as providers who are developing programs. And you'll get an opportunity to learn a little bit more about what sex positivity means and what it means for us as providers and as trans and non-binary people as we're moving through these services. So I'm very, very excited. If you are joining live, on Facebook or Instagram or LinkedIn or YouTube, please feel free to put a hashtag live in the comments. I see some folks are waving. Hello, Evolve. Hi, Ty. Thank you for being here. So please feel free to put a hashtag live in the comments, or if you are joining on the replay, feel free to put a hashtag replay and share with me what you found the most useful from this, or if there's more questions that you have, or if this brings up more for you. Um, Again, my name is Miss Jai. I use feminine and masculine pronouns. I am the host of Ask Miss Jai Live. I come here every Sunday at 5 p.m. Pacific Standard Time in order to provide information and help for folks who are wanting to learn more about how to provide services for trans and non-binary people. I am a sexual health educator by trade, and I've pretty much grown up professionally in the public health field. So I'm very excited to share this information with you all. So one of the reasons that this topic, specifically sex negativity and sex positivity, has come up is because there has been we see sex negativity and we see the effects of that all around us at all times, but it sometimes can be very difficult for us to name it. So first, I think it's helpful for us to get some common definitions on what we're talking about. So when we think of a sex negative society or we think of sex negativity, what we are talking about is a society that really says that sex is something that is abhorrent, something that should be avoided, or that if we are going to engage in a sexual way, that it's going to be done with severe self-discipline. So either severe self-discipline or completely avoided altogether. The way that sex is then talked about and constructed in our society is that sex is either risky, inherently risky, or sex is a problem, or is the result of a moral failing or a moral deficiency. And at times sex is also seen as adversarial. It's almost like we're combating a wave of sex, essentially. And so what this ends up resulting in, and what we might have seen, is we see that in societies where sex negativity is really prevalent, that there's a legislation that criminalizes sexual behavior and sexual acts. So this is especially pertinent as we're moving into 2023, because 2023 marks the 20-year anniversary of Lawrence versus Texas, which was the decision that overturned anti-sodomy laws. And so before 2003, in several states in the United States, it was illegal to engage in sodomy. And sodomy was defined as any sort of sexual act that was outside of vaginal penile penetration. So oral sex or anal sex was illegal in several states. And some states made it illegal just for folks who were of the same gender, and some states made it illegal for folks of all genders. So even heterosexual people who were engaging in anal sex or oral sex could potentially face criminal charges or face fines as a result of these anti-sodomy laws. And so in countries where we see this legalization or this criminalization of sexual activity, this is a very sex negative response. So it's treating sex or it's treating sexual behavior or consensual behavior between adults as something adversarial or something as a result of a moral failing. We also see this in the way that we sometimes provide messages. So as sexual health educators, we might create messages for our community that equates things like exposure to HIV as contracting something like really terrible and life threatening. So I think of the advertisements that showed wasting syndrome, and I think of the advertisements that made us question whether or not we could trust our partners. So several of the advertisements from like the AIDS Healthcare Foundation in the early 2000s and advertisements from overseas showed that HIV was something to be terrified of, and so it made us really afraid of engaging with one another or talking about sexual activity. And so, what ends up happening in sex negative societies, or what happens in sex negative messaging, is that there's less of a willingness to have conversations about the types of sex that we're having or the ways that we are wanting to engage and wanting to explore. And so, if we're less likely to have those conversations, and we're less likely to, especially have those conversations with our providers, because we assume that there's going to be this adversarial component, or we assume that there's going to be a negative response, then we also see that that creates an additional barrier to things like HIV testing, STI testing, family planning, and other ways that we could talk about sexual health. So it decreases that willingness to discuss sexual health. It also decreases the willingness to actually seek out sexual health services. So I think about the fact that there are HIV criminalization laws in the United States, in several states, and HIV criminalization laws can make it so that if someone contracts HIV from a partner, or if someone who's HIV positive engages in sex in a way that could potentially transmit HIV, then they're opened up to legal ramifications. They're open up to criminalization. They're open up to all these different things. And what that ends up doing is then makes it disincentivizes the willingness to get tested, because if someone doesn't know their status, then they can't potentially be open to these additional criminal charges, or these laws and policies, and less likely to engage in care and maintain in care because of fear of what it means to potentially see these legal ramifications. And so we're less likely to seek healthcare when we're receiving sex negative messages. And I think that some of the helpful things are examples when we think of examples of sex negativity. So I think also how sex negativity can look on the interpersonal level. So I've already talked a little bit about legislation, I've talked a little bit about advertisement, but as a medical provider, as someone who's doing HIV testing, as someone who's doing some sort of sexual health education, coming in from a sex negative perspective would be making assumptions about the ways that someone is engaging in their sex or sexual activity, making judgments about the ways that folks are engaging in sex or sexual activity, and really almost treating the encounter as this as a parental figure. Like you're trying to uh, be the parent to the person that you're helping, or the person that you are collaborating with on their health, and telling them what they should or shouldn't do with their bodies. And so it's also this like removal of autonomy. And so what ends up happening is that we then have stigmatization that happens with, especially with sexual minorities. So if we're already saying that like sex and sexuality is something that is negative, sex and sexuality is something that can only occur in certain ways, and when it occurs outside of those ways, it's something that is a deficit or something that is harmful, then we automatically start stigmatizing those who are already othered in our society or seen as abnormal. And so the way that this ends up happening is that we have sexual health programs that either make assumptions about the ways that folks are engaging. So sexual health programs that assume that all gay men are promiscuous or having sex with multiple partners. Um, Having sexual health programs that assume that trans men don't have any cis male partners, are only engaging in sexual activity with cisgender women. We also see legislation come about from this as well. So I think about how where I live in Arizona, up until 2016, we had laws on the books that said, we called them no homo promo laws. But essentially, what they said is that if you receive funding from the state for your school, for your public health, or for your public education institution, if you receive money from the state, then any sexual health education that you teach cannot say that there is a safe way to engage in sexual activity between gay men. And so, what would end up happening is that if any sort of discussion about homosexuality, it was always also only gay men. Very rarely was queerness with cisgender women ever discussed in terms of sexual health. But any sort of sexual health class that you had to take as part of your graduation requirement, if they talked at all about um, gay men, if they talked at all about gay sex, they had to say that there was no way to engage safely and that the engaging in sex between gay men would result in HIV. We know that this isn't the case. We know that this is incredibly stigmatizing and is unrealistic. But because it was codified into law, there was a requirement for that to happen if you were going to talk about sexual health. So it's stigmatizing sexual minorities. Sex negativity also results in sexual health being strictly the responsibility of the individual, and also any challenges with sexual health. So contraction of an STI, the ability to get family planning services, so an unplanned pregnancy, those fall squarely on the shoulders of the individual in a sex negative society, where there is the assumption that, well, if it wasn't for your moral failing, if it wasn't for wanting to engage in these ways, if it wasn't for engaging in a way that is problematic or risky, then you wouldn't result in this. In having this STI, you wouldn't result in having this unplanned pregnancy. And the reality is that for a lot of us, as we talk about health, we also talk about the social determinants of health. And the reality is that a lot of our health is impacted by the material conditions that are around us in everyday life. So if we are experiencing economic instability, if we're experiencing housing instability, if it's difficult for us to get to a medical provider, if we get to a medical provider and as trans and non-binary people are treated poorly by the provider, then we're less likely to engage in sexual health services, which means we're less likely to talk about preventative sexual health services, which means that we are experiencing greater rates and potential exposure to sexual health challenges. And so, or infections or unplanned pregnancies. So, because of this, we it's important for us to recognize that there's more than just the individual who is responsible for the experiences of sexual health. We also have seen that response on a systematic level to sexual health needs in communities also can dictate and determine how sexual health services get dispersed, and also the slow or facilitate the rate of infection, for example, amongst population participants. So we saw this with the HIV epidemic in the late 80s, early 90s, where there was a poor governmental response. And that poor response led to untold number of folks who were contracting HIV at an exponential rate. We see that there was a lot of grassroots movement during the monkeypox outbreak of this year. There's a lot of grassroots movement because getting vaccines was very difficult. There was a de-emphasis on where exposures were happening, and it was really being miscategorized as a sexually transmitted infection, predominantly in gay men. And because it was being categorized as this, there was less of a response on how to get the information out. And then when we started seeing folks in other populations who were contracting monkeypox, so we had children who were contracting monkeypox because it is contractable from skin to skin contact. When we saw cisgender women starting to contract, then we saw a response start to ramp up as well. And so part of this is like, where's the availability of vaccine? But the other part of it is that because we live in a society that already stigmatizes sexual minorities, the health needs of sexual minorities are often dismissed or are often deprioritized over other health needs. And then it's also it, it what ends up happening from sex negativity is that we have ineffective public health messages that go out into our community. We have ineffective public health services that happen in our community, and ultimately are just unable to provide public health and like health services, sexual health services, in an effective way that meets the needs of the community who are greatest impacted by sexual health issues. And so to switch gears, on the other hand, a sex positive society or sex positivity in messaging, it really emphasizes the pleasure, uh, the non procreative aspects of sex, the uh, the importance of uh, of how sex might mean to us. So the meaning of sex to us. It emphasizes aspects of sex that are not just related to how we are going to reproduce. It also emphasizes aspects of sex of pleasure and consent, the ways that we are feeling wholly affirmed in our sexual activity or our sexual health, and the ways that we are feeling are we the ability for us to access services that are going to provide us with the most informed decision making around the ways that we are choosing to engage sexually. So, and on top of that, sex positivity also helps us to recognize the cultural diversity that exists within with our sexual health. So the fact that like not everybody is going to engage in sex the same way, that making assumptions about sex, as I mentioned before, so assumptions about the ways that folks engage in sex because of their identity or because of their background or because of assumptions about their bodies. Um, it recognizes that those are not true and that really we need to treat individuals as individuals in the ways that they engage in sex. And also it helps us to recognize that there's a variation in the personal meaning and practice behind sex, right? So some folks sexual activity, I think about something that my mom said to me when I was very young. She said, "Well, when I was your age, sex was like a handshake," and so her belief around sex was that sex could be something that's very casual and that that could still be very affirming. Whereas there are other folks who the meaning behind sex might be much less casual. It might be actually much more personal and intimate, or might have a component of connection that is different. And so, not to put my mother on blast, but I think for those who knew my mother, that's also not a surprise. um, but I think it's important for us to recognize that we all have meaning that is different behind the ways that we engage in sex and the ways that that sex feels comfortable for us. And so some of the ways that sex positivity creates the shift for us is it allows us to focus on the strengths and well-being of the individual and what they're looking for in their sexual activity. So some of the ways that this can look as providers is that we can ask questions for folks around what are your goals for sexual health? Do you Are you comfortable with the way that you're engaging in sex right now? Is sex pleasurable for you? Do you have any questions? Is there anything that has changed over the last few years that you're concerned about? But really, like, getting back to the, like, what are the goals for you, and what are things that you have done already in order to embody that sexual health? So I think about my time as an HIV tester, and we would talk about sexual activity. And I think that in several sexual health program or lots of sexual health programs, especially HIV testing and care programs, I think there's now a recognizing, recon, I can't think of the word. There is now there's now an understanding that condoms are not the be all end all, right? There we know that not everyone uses a condom. We know that lots of folks opt to not use a condom for a variety of reasons. And I think that what this allows us to do then, when we take a sex positive approach, is we get to talk about the strengths. So, what have you done to reduce risk of STIs? What have you done to reduce risk of unplanned pregnancy? What are things that you do before engaging in sex with a partner to talk about what you would like out of the sexual encounter, or what your needs are, or what your wants are out of engaging in sex with one another? These are all ways that we can start to emphasize some of these strengths. So, are are the folks we're working with, are they talking to their partners before they're hooking up? Are they talking about HIV or STIs before hooking up? Are they doing any sort of visual check in order to see if there are any symptoms of an STI? Are they only having sex with folks that are vetted sexual partners so that they've had sex with in the past? Are they doing only engaging in certain kinds of sex that actually put them at lower risk for HIV and STIs? So these are all ways that we can have these or start these conversations to emphasize the strengths and the well-being, or the strengths that the individual brings to the table and what they're already doing to protect themselves. It also helps us to recognize that individual sexual activity is unique and open up conversations on what that unique sexual activity can look like and where that intersects with the health of the individual. So I think that oftentimes when I was working in a health setting, when I was working in either in a hospital setting or I was working in a testing, like a public health agency, I would be reached out to in order to have conversations with folks about things like kink or fetish or sexual activity. that, like, the one that comes to mind most recently was I had a colleague of mine reach out to me asking if I could have a conversation with a patient around fisting, and specifically around the health aspect. So, like, what are some things to keep in mind for our bodies? What are some ways that we're hoping to engage? What are some boundaries that we have that we already know going into this are going to be important to emphasize with our partners? So, all of that is appropriate and within the purview of the sexual health discussion, because all of that is necessary for the health and well-being of the individual. If they are going into it and they're experiencing physical pain, if they're going into and unwanted physical pain, if they're going into it and they feel like their boundaries are being crossed because they haven't talked about or discussed how they're going to advocate for their boundaries, if they feel like they can't have these conversations, this sort of like helps folks get to that point where they're able to still engage in sex in the ways that they want and they feel affirmed, but they're also able to make informed decisions about their health and wellness in that situation. It also puts the ownership of, or it also approaches sex in a collaborative way. So it helps us recognize that there are many ways of knowing about sex and sexuality and sexual health, and that we really don't need to be the expert in everything. I think oftentimes folks go to a provider and make the assumption that this person is going to be an expert in all things, no matter what we bring up. But oftentimes, I find myself very much like if I hear a new word, for example, I might not know what it means. And so it's not up to the patient or client to educate us, but it is appropriate to approach the conversation with curiosity in a way that is appropriate. So, if, for example, if someone says to me, if I ask someone like, "What kinds of ways do you enjoy? Or what kinds of ways do you like to have sex?" Or I want to make sure that I'm asking questions about sex with you. And so, what kinds of ways do you like to have sex? And someone says, "Oh, I really enjoy splashing." I might think to myself, I don't know what splashing means. And so it might be appropriate in that situation to say, tell me a little bit more about what splashing means for you. Tell me a little bit more about what kinds of activity you might engage in with splashing, or I'm unfamiliar with the term splashing. Can you share a little bit more so I can understand and talk to you about this in terms of your health and well-being and what your sexual health goals are? But sex positivity is also not one size fits all. And because it treats folks as unique, it also means that we have to approach sexual health education from a perspective of informed consent. And I don't mean just informed consent like folks filled out paperwork and they agreed to informed consent or they agreed to procedure, but also informed consent in terms of asking folks if they are comfortable to have these conversations with us as trans and non-binary people, as queer people, sexual minorities and gender minorities, there is a long history of being mistreated by medical establishments. There's a long history of being treated as almost like this sideshow or in this like freak way, where bodily autonomy was often taken from us because of the curiosity of providers. And so when I say approach with curiosity, if it's something that's been shared by a patient or client, it's appropriate to ask about. But launching into sexual health questioning with the assumption that everyone is going to want to talk about sexual health is not appropriate. So instead, we might ask questions like, or we might say things like, part of today's visit is that we're going to be talking about is talking about sexual health, and that includes the ways that you have sex. That includes the ways that we talk about sex, the partners that you might be engaging with. Are you comfortable with having that conversation with me today? So really asking questions of the individual and asking for permission to talk about sexual health and sexual activity, because as I mentioned at the beginning, sex positivity allows us to recognize that there is cultural diversity in the ways that we talk about sex, and also recognize that there is the meaning of sex is going to be different for everyone. So where I might be able to talk to someone who is very open about sex, or I might be able to have conversations with folks who look very much like me about sex. There may be someone who's coming from a cultural background where it's very taboo to talk about sex, or talking about sex with someone of specific genders is actually very uncomfortable or is culturally forbidden. And so, in order for us to meet folks where they're at, we have to give the opportunity to talk about these things, but also give the autonomy to the individual on whether or not they are agreeing to talk about these things. Um, and I think sometimes we get into this place of like, well, if I don't ask the questions, then we won't get this information. But the reality is that we are trying to build rapport and trust with individuals, so that we are able to better give overall health and wellness information and help improve the overall health and wellness of the individual and of the community that we are serving. And so if I don't get the information in this one setting around sexual health information, then I might not get it in that setting. But I may have planted the seed that it is safe to come back to this setting to get testing in the future. And I'm not going to be asked invasive questions without my permission. I may have provided the opportunity to talk about been provided the opportunity to talk about these things. And I know that they're available to me when and if I want to get them in the future. So I think the way that we approach informed consent is really important. And then in that it also honors the individual, right? So it honors that the individual has ownership over their bodies, especially in settings where bodily autonomy and bodily ownership may have been historically stripped away, or we may have experienced discrimination in the past around our identities. And in that, it also helps to open communication. So the I think one of the really big things for us to think about as well is that I've been in conversations with many folks across my time who have felt judged by their providers, who have felt that their providers didn't understand them, or made assumptions about them and launched into information that was unhelpful for them. And so part of taking a sex positive approach of asking questions about if it's okay for us to talk about sexual activity, of not making assumptions about someone's sexual activity, of not making judgments about someone's sexual activity. It also encourages peacemaking and improves interpersonal communication between the provider and the patient. And so the number one request that I hear very frequently from folks is that they want to learn how to improve patient provider communication between themselves and the LGBT community, or between themselves and the trans and non-binary community. And I think that if we take a sex positive approach in our sexual health education, where we provide and give folks the ability to engage in ways that feel safe, we provide folks with information and then let them take the lead on what their sexual health is. We ask folks what their sexual health goals are, and we talk to them about the ways that they are what is pleasurable, what they're enjoying, what they like about sex, the ways that they're communicating with their partners. Then we are providing them with the opportunity to come together collaboratively with us as providers, as opposed to telling them, well, this is what you need to do because you are at risk for HIV, you need to get on PrEP. Because you are at risk for HIV, you need to use condoms. Because you're at risk for HIV, you need to do X, Y, or Z. And there are lots of folks who those are not viable options for them because of a variety of things. I know a lot of folks who are not interested in PrEP, not because they don't understand that PrEP can help reduce HIV risk, but they're not interested in PrEP because they are uncomfortable with taking a medication, or they're distrustful of the medical environment. And there's a high level of medical touch in the way that PrEP is distributed and the way that it is monitored. And so having conversations with folks about alternative ways that they can explore their sex and sexuality, and also make informed decisions about that risk and benefit, is a sex positive approach to the ways that we provide this information. So I think that the final thing that I'll kind of wrap this up with is that I think when we think sex positivity, there's this assumption that if we are sex positive, or we're asking someone about pleasure, if we're asking someone about the ways that they talk about sex, or that they engage in sex, then there will be this assumption that that person assumes that we want to have sex with them, or that we are asking questions that are inappropriate. And so often the feedback I get around sex positivity and having these conversations is, well, what if folks are offended by these questions? And I think what is important for us to keep in mind is that taking a sex positive approach means that we are approaching folks and meeting them where they're at. And in a lot of ways, it's a harm reduction approach, right? So we're meeting folks where they are at in order to provide them the most information that is applicable to the experience that they're engaging in. And so before I launch into asking someone what they do sexually, that what how they enjoy pleasure or how they enjoy sex, what things they enjoy about sex. Before I launch into any of that, I'm going to ask someone if they are comfortable talking about sex with me, letting them know what kinds of questions I'm going to be asking and also why I'm going to be asking them. So I'm not going to say, we're going to talk about sexual health. Are you comfortable with that? Yes, awesome. What do you enjoy about sex? What things do you find pleasurable about sex? Instead, I'm going to say, are you comfortable with talking about sexual health today? Yes, awesome. Let me share a little bit with you about how we talk about sexual health here and why. We talk about sexual health by talking about not only the experiences of health risk or pregnancy, but also what are your sexual health goals? What are things that you enjoy about sex? And what are ways that we can reduce those risks that are commonly talked about while also still emphasizing and maximizing the things that you enjoy about sex? And how can we work together? How can I give you information so that you can make informed decisions for yourself around the ways that you are going to engage? And then if someone says to me, "Well, no, I don't want to talk about that," then I get to respect that decision and say, "I respect your boundaries. If you change your mind and you would like to talk about it, please let me know." Or if they say, "Okay," and we start talking about it, then I can remind them, "At any time, you don't have to answer these questions. We want to make sure that we are emphasizing your autonomy in sexual health education." So I gave a lot of examples, some ways that of what sex negativity looks like. There's lots of examples of sex positivity in the ways that we create messages and programs as well. I think that I could endlessly go through examples, uh, and we really haven't even touched the surface of other types of things to keep in mind. So, sex positivity is really just talking about the ways that we approach conversations about sex, sexuality, and sexual health. But there's also an importance of having representation in the media that we are putting out there. So, and not just like checking off diversity boxes, but are we working with the community that we serve in order to provide sexual health messages that are appropriate and culturally affirming? Are we working with communities to provide sexual health information that includes communities that are often left out of sexual health information. So communities, uh, people who are living with disabilities, folks who are deaf and hard of hearing, communities that oftentimes don't have access to medical care or the ability to get services. So it's important for us to recognize that this goes so much more beyond just, are we not actively being harmful? But I think that's really where we start, is, are we actively not being harmful? So if you run a sexual health program, I'd love to hear some of the steps that you've taken in order to move from sex negativity to sex positivity. What are some marketing or materials or messages? How are you training your staff in supporting sexual health conversations? What are ways you're moving away from just risk assessment language to language that recognizes that sex is, for a lot of folks, is an affirming, pleasurable, enjoyable experience? And what are some other ideas you have on how we can create sex positivity in the services that we provide? So I want to thank you all for joining for Ask Miss Jai Live tonight. It went a little bit longer than I anticipated. I said 15 minutes. I gave you 30. But if you are interested in learning more about Ask Miss Jai, if you're interested in learning about resources to support trans and non-binary patients and clients, or learn more about the trainings and the programs and free offerings like this that come up, please go to www.askmissjai.com. At the bottom, there is the option for a mailing list. Please join the mailing list. We send out a weekly newsletter that shares a gratitude that I have for the week, that shares one or two announcements around things that are happening within our program, and then also shares one resource that you can use, either by providing it to trans and non-binary people in your services, or that you can use as a provider to help inform and improve your services for trans and non-binary people. So with that, I really want to thank you all for joining me today or tonight. And as always, my name is Miss Jai. I am very excited to bring these to you every week. And I want to thank you all for supporting this program and supporting the work that I am doing through Ask Miss Jai and Ask Miss Jai Live. And as always, thank you for investing in the health and well-being of trans and non-binary communities. Much love to you all. Have a wonderful rest of your Sunday.